my name is Veronica and I will be your nurse today. I'm going to be doing your wound care per the doctor's orders. Can I have your first and last name? Okay, and what's your date of birth? Do you have any allergies? Okay, I'm going to just double check your wristband. Okay, I'm going to go ahead and give you some privacy and do an environmental check. I'm aware that you were medicated about 30 minutes ago for pain. How do you feel right now? Do you have any pain? No pain, okay. So I'm gonna go ahead and remove this old dressing, clean your wound, and apply a new one. If at any point in time you have any pain or feel discomfort, just let me know, okay? And I'm gonna go ahead and wash my hands for 20 seconds for CDC guidelines. And I have all my things here I'm gonna set up. And I'm gonna don my non-sterile gloves. Okay, so upon removing the dressing, I'm going to examine the dressing and the wound. So I'm going to go ahead and remove this dressing. Okay, so I see that the wound is about light pink in color. The patient actually has two wounds, upper and lower thigh. The edges are clear. There's no odor coming from the wound. The consistency is minimal but watery, and there is small amounts of serous sanguinous on the actual dressing and a little bit around the wound. So there's no swollen. I don't see any swollen around the wound. No infection noted. The edges are, like I mentioned earlier, clear, and I can tell that there is new tissue growing around them. So that's good. I'm going to go ahead and measure. Okay. And do the other one. Now I'm going to do the length, the width, and the depth. These are my sterile swabs. Here's my other one. Okay. Okay. So now I'm going to go ahead and irrigate the wound. So I'm going to open this, pour some out, and then here. Now when I'm irrigating the wound, I'm going towards one direction until I see clear. And I'll do the same for the other one. My sterile gauze. I'm going to go ahead and tap downwards towards one direction. Make sure I clean all of the exudate the wound has. Okay, now that the wound is cleaned and we've measured it, I'm going to go ahead and set up my sterile field to take a specimen sample, pack the wound, and close it. my sterile dressing tray. Sterile gloves. This wound is a little bit smaller than this pad, so we don't need the whole pad. I'm going to cut it in half. I'm going to take a specimen collection of each of the wounds. So I'm going to go down one, and I'm going to put it in my specimen cup. I'm going to take another swab, go down one, put in my specimen cup, and discard. So now I'm going to go ahead and pack the wound. Go ahead and close it. Right. I'm going to do one more tape with my name, initials, and time on it. Perfect, and we're all done.